I'm Dr. Joanne Smith.
And I'm Dr. Clin.
And this is
a pod full of pediatrics.
And this is the one
where we talk about the COVID and COVID vaccines.
COVID vaccines, yeah. So this was a hard one for us to do. We've kind of been putting it off.
Yeah, because it's, I think because it was a hard time for us, right? And I think a hard time for the world in general. And so it tends to be when we have things that are hard, we don't want to think about them and like kind of pay attention to as much.
We don't want to rehash them too much.
We don't want to rehash them. But I think this is actually an example of kind of why I wanted to, or why I made her come and do this. And I don't know if anybody ever looked at our first ones who's doing it now, but like in our first one, we talk about the fact that like we've been friends since we were 12. And like as soon as she moved out here, I basically said, hey, come help me do this podcast. Kind of said, you're going to help me do a podcast.
Yeah, you told me like the month before I moved out here. And then like the week I moved out here, you're like, we're recording. And I was like, okay.
I know, it was very mean of me.
No, it was.
But we
jumped
did it
right on the wagon.
Yeah, well, because I wanted to talk about really vaccine safety and how much it had improved like our world. And we wanted to talk about other things in pediatrics too. But really that was part of it, is like really trying to get out some good information about things. And right now, the narrative about COVID from really some, what you would expect to be like authorities is not true. And that's really, really hard for us.
For us, we've lived through it, right? I mean, as a lot of people have, but we've lived through it on the inside as healthcare professionals, actually seeing what COVID was doing to our patients and to their families.
To our friends and coworkers and all of that, right? Like, so it was a particularly hard time, I think, for healthcare people in general. And so this is a hard topic for us. And I guess we kind of just wanted to own that, like, this is a hard thing to talk about. And not because we don't believe in the COVID vaccine, and because I am so very, very thankful for the COVID
that it was
vaccine.
Created.
Yeah, like I'm amazed and grateful every day that we have, people who are so interested in vaccine technology
and so intelligent
and so good at it that they can come up with things that saved millions of lives.
Yeah.
And so for me, that's what it is. But we understand that it is harder for other people to hear too, and to listen to. And so we just kind of wanted to put out there, at first, we know that most of you don't want to think about what happened in 2020 either. But that was the year that the world kind of shut down.
It did, and it was such a strange time because we didn't know, right? We were talking about like hindsight 2020, right? You can look back and be like, well, that was wrong. We didn't know, right? When this started at the end of 2019, the beginning of 2020, people were just dying, and they were dying of complete respiratory failure. And it was happening so fast. And it was, yes, some people with some pre-existing conditions, but it's also healthcare workers.
And healthy people.
And healthy
people.
That were just
in their
dying.
20s and 30s dying, right? And it was crazy because we had never lived through a pandemic before, right? And so the last pandemic prior to this one had been in 1918 with the influenza pandemic of that time, and we had never done that, and we kind of thought that we were somewhat prepared, like we had seen some SARS and other stuff,
or healthcare across the world thought we were kind of prepared because SARS was a respiratory virus that caused respiratory collapse.
Right, but we were definitely not prepared for this, and that was what was hard for us. And I really hope that at some point we can get to really, really honest conversations about this, because I think the only way we're going to do better at this in the future is to really look at honestly what did work and what didn't, and make sure that we use those sources that worked in the future with the next pandemic. Because guess what? There will be one.
There will be one. Yeah, and I remember when this happened in 2020, one of my nurses got so angry with me because she said, "You made this happen. You said this was going to happen." And I was like, absolutely not, because I had that original thought, right? People had been talking about it was bound to happen. Eventually, there was going to be a strain, which is what COVID-19 was, a strain of a virus that we knew this virus, but this was a new viral strain that our bodies had never seen, so everyone was going to catch it and get sick with it.
Right. And that's exactly what COVID-19 is. It's actually a strain of the coronavirus family. Corona. So the coronavirus family, and the coronavirus is actually, up until that point, was really just bad, like colds, not even necessarily bad colds.
No, we just kind of blew it off. You're like, when we saw it back in a respiratory viral pandemic, like, good, they have coronavirus.
That's right. Like, it really wasn't a dangerous virus. They had lots of different strains of it, but not ones that were typically ones that we would think would hurt anybody and cause hospitalization or real illness. And it was a really frequent cause of just the common cold.
Yeah.
The difference was this new viral strain, and our bodies had never seen this new viral strain, and our immune systems were just not prepared for it.
And it came so differently to different people. Sometimes it could just be like a cold for some people, COVID-19, but sometimes it was more serious, and it would cause vomiting and diarrhea, rashes, COVID toes. Then the first strains really caused the loss of sense of smell, which was so unusual, seizures, and then we talked about complete respiratory collapse in some people.
And death.
Which led to death.
Yeah, and then there are other less common but more serious conditions that came with COVID-19, which are like the myocarditis, which is basically just an inflammation of the heart muscle itself. It is rare. It can occur really with any type of virus, like especially your more kind of severe virus, but it definitely happened more often with COVID-19. And it occurred often, interestingly, in younger people. So we saw
kids,
that.
but more like teenagers.
Yeah, teenagers and young adults, I should say.
Yeah.
Younger people and that type of thing. And it really can cause problems in these children and adolescents.
And there was something called multisystem inflammatory syndrome in children. So this really only happened in kids, but again, kind of older children and adolescents. And it's a rare condition that's pretty similar to Kawasaki's, where you have fever for 4 to 6 days, pink eye, swollen hands, feet, rash, mucous membrane swelling, but then also had some GI symptoms, really bad abdominal pain, sometimes diarrhea. Some 50 to 90% have heart involvement, which can also happen with Kawasaki's, and then 20% of the patients had neurocognitive symptoms like seizures and encephalitis. And it's an autoimmune reaction to the virus, and it's something that we don't really know why it happens, but it did happen in kids more than adults.
And it's actually, the interesting part about that is it really did look like Kawasaki's, and Kawasaki's is an autoimmune thing that we talk about a lot, that we don't know what virus causes that. Like, it has been around forever. We still don't know what virus causes. There's all different types of virus that can cause it, and it's really the autoimmune reaction to that virus that causes the inflammatory response and the vasculitis. And that seemed to be what this was too, except it was after COVID. Yeah. Like, it was a COVID response, autoimmune disorder for it.
And overall, COVID-19 is not as dramatic, in kids compared to adults in terms of the death rate, but definitely kids were hospitalized and died.
Especially in the early part prior to the vaccine. So approximately 234,000 children less than 18 years of age were hospitalized for COVID between the fall of 2020 and the spring of 2024. That is not near how many adults were hospitalized, right? So it is definitely less than adults, but that's still a lot of children. Overall, the severity also varied. And interestingly, severity and hospitalization even varied for age, and in a weird pattern.
Right, exactly. The babies are always more at risk because their just immune system is not that up to par yet, right? So less than 4 had about 66.8 per 100,000 children were hospitalized.
But then weirdly, 5 to 11-year-olds had some weird kind of protective factor. I don't know, they didn't get hospitalized very much. And then your older adolescents, 12 to 17 years, actually seem to be more like the adults in some respects. Not quite as severe, but they got more COVID-19 associated hospitalization, and often had some of the worst side effects from it, including they were more likely to get long COVID.
Right. And long COVID is such an interesting thing because we really don't understand it.
We still don't understand
We still don't understand
Yeah.
it. But this has happened with other viruses before. We talk about EBV, which causes mono, can cause a similar disease state where just after the acute illness is over, they are just not well for months,
Yeah.
right? So fatigue and just belly pain and low appetite and
Sometimes
muscle aches.
with COVID-19, you actually can have chronic cough.
Chest
which
pain.
doesn't typically happen with EBV type things, but like that fatigue, like just feeling horrible and not yourself is kind of in the inherent part of long COVID. You don't sleep well, you have headaches.
And brain fog. That's
Yeah,
what people
brain
talk about
fog.
a lot, right?
Like,
they just can't, they're not as quick with their responses. And
that can happen for months and months, even up to like a year after COVID. And so, those were all things that happened that we saw secondary to the COVID-19 virus that was really new, that we'd never seen before with a coronavirus.
Right.
And unfortunately, it caused a lot of death. Like that first year was really, really scary. And we can always look back and say what we should or shouldn't have done. But when we had the amount of people dying from COVID and healthcare workers and other people trying to take care of those people, sadly, we are not counting as much anymore right now under our current administration. But at the last time when we stopped counting in kind of 2024, there are over 1.2 million deaths secondary to COVID. And the narrative is that those are like over exaggerated. In actuality, studies have found that if anything, we have undercounted
Yes,
those.
I mean, definitely at the beginning, there were a lot of people who would be brought to that hospital and ER who had already died at home, and we didn't know what they died of, but we assumed they were COVID, but you couldn't say that they had.
Right. And there was even ones in there where they didn't test as much. Like,
right. Or we didn't have tests.
We didn't have
tests.
tests.
Time period, we didn't have enough tests.
We did not, right? So, and so if anything, we have undercounted deaths by COVID. But 1.2 million people is
it's a whole city. It's the city of Indianapolis.
Right. And so it was really terrifying and scary to live through that. And there's still, parts of like, and just to say too, like that's a similar number to the rest of the world. So like these numbers kind of fit in the sense that it's not just the US and where we were really trying to count, but if you look at the rest of the world, those are very similar kind of numbers. So we do know that they are accurate.
But there was a big game changer.
There was,
yes.
Thankfully. And like they said, like we are very grateful for this.
Yes.
And it was the vaccine.
Right. And it was, at the time, we were healthcare workers, really like that first chance for hope, right?
Yeah.
We're like, oh my gosh, we could actually make a difference here. Like we can actually protect people and stop them getting sick. And we as healthcare professionals were really jumping on board to get the vaccine.
Yeah.
Right? We're like, please
let us be the first people getting it.
Well, absolutely, so that we can help protect
we wanted the people who were most at risk, definitely your older population, but like healthcare workers especially, we were just getting exposed because we were trying to take care of those people. And again, Joanne and I saw less of it because we were pediatricians, but we're in a rural area. We work with everybody. Like we're in a community health center where we saw adults all the time. Like it was in our community, it was in our lives, and this was our first chance.
I worked at a COVID clinic, which the organization I worked for separated one of our offices and made that the COVID clinic, that if people had symptoms, specifically that would be in line with COVID, you went there as opposed to our regular clinics. And I did not see many pediatric patients there because they just weren't getting sick with it, but there were really, really sick adults there.
Yeah. And so, we had during that early before the vaccine, we saw it still saw a lot of more higher risk for youth, our young babies, like less than 6 months had that higher risk of hospitalization. And then once the vaccination, even before we had the baby vaccinations, once we started vaccinating older, school-aged and all those, like we actually saw a decrease in hospitalization across the board with adults, adolescents, children, and even infants before they were vaccinated. So
And what was amazing, in 2021, they did studies across all age ranges, and the vaccine was 89% effective against laboratory confirmed COVID, leading to hospitalization,
90% against infection leading to ICU admission,
and 91% against infection leading to emergency department or urgent care visit.
Now, that didn't mean you didn't get COVID.
Right.
Like, I think this was also a really hard thing for people to understand. And we've talked about it in our other vaccine episodes. Just because you have the vaccine doesn't necessarily mean, like, especially with influenza, it doesn't mean you're not going to get exposed
And that was never the
actually
claim.
get
The claim is
influenza.
not to be, I'm not going to prevent the disease.
Yes,
I'm
it was preventing
the bad part of the
complications
disease,
from it.
hospitalization and death, right?
Right,
ultimately.
hospitalization and death, yeah. And so that is really the only thing that we were really trying, which is why these data actually really just looks at the effectiveness towards hospitalization, ER visits, urgent care visits, and death.
Which is 90%.
Yeah.
It's a really good vaccine.
It was a really good vaccine, and really effective, and it was different. It was a totally different vaccine. We have not seen one like this, and I think that was like scary for some people. We were just excited to have something. So,
and something that, you know, it wasn't novel to the scientists making it. They've been working on mRNA, can't say it fast, vaccines for a long time for other disease states, for Ebola, for influenza, for rabies, and they were making good, safe vaccines, but they just had to pivot to make it for COVID.
Right. And you know, messenger RNA, or the mRNA, was discovered actually in the 1960s. So again, not new.
No.
It is, we were saying that, like, we did learn about it, but we didn't know as much about it when we kind of
learned in AP Bio is what we decided.
Yeah.
Maybe, like, just like what it did.
Yeah.
Not much about it.
And it's kind of cool because it is the part of the cell. So it's in the cells, right? But it actually is the part of the cell that is the messenger. Which is hence the name, the messenger mRNA. So, and it's we kind of were talking like, how would you like describe it? And it's kind of like email.
Yeah, you send it a little message, and then it just kind of gets erased because you don't need the message anymore.
You don't need the message anymore, and that's the thing about mRNA that actually made it so hard to work with, and why it took so long to develop things that actually worked for it. Because the mRNA is really just that messenger function, and it needs those instructions to work correctly. So all of our cells need the mRNA portion to give it instructions to work well. But then once those instructions are delivered, it just goes away, and it gets depleted and erased kind of from the cell.
Destroy message upon reading.
Destroy message upon reading. That's right. That's all that happens.
Yeah, exactly.
So in essence, the scientists have been trying to work for decades to actually use it to treat something, because it kept degrading. Like, you'd get it into the cell, and then like it would
like I read it, throw it away.
Yeah, we don't need that. We're not keeping this other extra stuff around. We are not hoarders.
No, your cells are very much clean slate, like very clean living, clean spacious.
That's right. So, and then they figured out this cool advances in nanotechnology. And again, nanotechnology is actually not computer, like little coded nano.
It is so scary, but it's really just really tiny.
That's right. Technology of really tiny things. So this is actually fat particles that are really tiny.
Yeah.
That coat the mRNA
and like a bubble wrap.
Like a bubble wrap. I love bubble wrap. I think that's a great idea.
I think that's good.
It's so fun to pop, but that's the thing, is it actually takes a long time to pop.
Yeah, exactly. Right. So it covers the mRNA and goes into the cell, and then the cell's popping it like you do when your kids like jump on the bubble wrap to pop it off. That's happening, but it just takes a minute, and so there's time for that mRNA to give its message before it's destroyed.
That's right. And so that's really what it is. It's like this bubble wrap that eventually does get destroyed, but it takes a while because of these tiny little particles, fat particles around it. And so once it does, the mRNA message actually could develop, like kind of present that spike protein to our cells, and our cells could start to make the antibodies towards it. And that's how they really got our cells to recognize that this was the spike protein we wanted to make antibodies for.
Again, it's not giving the disease, right? Just we talked about with the other vaccines. It's just giving a tiny little part of the disease. So
the protein itself.
The protein itself, enough that your body can be like, that ain't right.
Right.
I should work on that, but not enough to actually get sick from it.
Right. And so it added a chapter to the instruction manual.
That's so cute.
I know, I like that.
I like that. I like that little metaphor there.
Yes, to how to properly fight the COVID-19 virus.
And this comes in many languages. It's
That's right.
translated, and it's not just like the little IKEA ones where it's just like people. It's actually some like words. Some
That's
code.
right.
Yeah.
It is code that kind of gets translated really nicely and adds that extra chapter. And so there's different types of vaccines. There's like basically 2 mRNA vaccines.
2 different competitors, right?
Yeah,
Different
Moderna
brands.
and Pfizer. And they have a slightly different way that you give them, but basically they are approved from 6 months to to over 65 years for those vaccines.
The schedule's gotten a little confusing just because of different messaging, but the basics is that after your initial doses, because you get a booster the first year, then you plan to have one once a year, and we're kind of planning for the winters because that's when the spike of COVID is happening.
Right, unless you are over 65, because it makes you inherently have a higher risk of problems with COVID, or you have other medical problems, chronic medical conditions that again make you higher risk for COVID. And in those situations, they recommend the vaccine every 6 months. And again, that actually is based on data because what we found is that the vaccine sort of starts to degrade and not work as well after about 6 months.
But your response to the vaccine.
Your response to the vaccine.
Yeah.
Right, sorry. Your response to the vaccine is not as hardy after about 6 months. And so that is why they recommend kind of doing it every 6 months in people who might have more of a problem with it, with COVID vaccine.
And then
with COVID, not with COVID vaccine.
And then there is another non-mRNA COVID vaccine.
Yeah, and that's really more like the original vaccines, but it was still faster because it's kind of cool.
Yeah, talk about that one, Clin.
I do think it's kind of cool, but anyway. So basically, it's Novavax. And it was like this small company out of Maryland that had really never brought a vaccine to market, but they actually combined the protein, again, that little part of the protein that we need to recognize and start to make antibodies for, with a compound from the soap bark tree.
Which I'd never heard of that tree.
I haven't either.
I'm super curious about that.
I don't know, but I guess our cells don't like it.
Or they just recognize it. They're like, what is that?
It's a great adjuvant,
Okay,
right?
great,
We talked
good.
about those adjuvants, right? So it helped our body kind of make that response. It has a longer track record. It has similar, actually, side effects. The difference and this is what's so cool about it, is that it would have been really slow to make had we used mammal cells like we'd use with all other types of vaccine like that. Instead, they put this one in moth cells.
Which is so
And
interesting.
I know, it is so interesting. And these little factories just pumped out like the coronavirus proteins so that our body could so those could be used in the vaccines to help our body recognize COVID and make effective response to it.
Yeah.
So it was super cool. And that one's, again, it actually came out not too long after the mRNA vaccines, like within the next year.
Yeah.
Which was super neat. And so vaccines have been really helpful, really successful. We're not going to talk about the Johnson & Johnson vaccine that came out around the same time as the mRNA because that was actually never approved for children.
Right. And we only talk about pediatrics.
And we only talk about pediatrics, but that one was taken off the market because it did have some side effects that were much more significant. And that was actually and that was not an mRNA vaccine, no. Actually. That was a completely different style of vaccine too, but one that did not work as well, and also was more dangerous. And so they took that one off the market, and we don't see that one at all. And it was never approved for children.
But the vaccine worked really well.
It did. It worked amazingly well. I mean, it is really credited, and we credit it, all of true healthcare credits it for saving millions and millions of lives.
Absolutely. And we're not seeing such a great success rate right now because the virus has changed.
Yeah.
Right? I mean, that's the deal with viruses. Why it was such a problem at the beginning is that they mutate. And viruses want to live. And so if they kill off all of their hosts, then the virus doesn't exist. So the virus tends to change to be like, okay, I'm not as bad anymore, guys. Don't worry about it.
Mm-hmm. And I think part of it too is that we've also had a lot of people who've had the disease, who've had the vaccines for it. But even in the newer strains, for people who are who have never had the vaccine before, it doesn't seem to be as bad as the original strain.
Right.
And so that has been shown to be the case. So,
you know, and we know that the vaccine was effective. It's hard to know now because we're not really collecting data on it, unfortunately, of where the efficacy is, but it's still a safe vaccine. Side effects are like the usual vaccine, right? It hurts where you put it. Maybe you have a low-grade fever, some body aches. Maybe you pass out, especially if you're a teenager. But that's more like the vagal response we talked about before.
Yeah, and it was the myocarditis, was one of the things that they did find as a side effect for the vaccine. And I think that is scary for a lot of people. And certainly, we thought a lot about it when we had adolescents getting vaccinated, and our kids were even getting vaccinated. And it was really interesting because actually some of the doctors in Oregon were the ones that kind of first helped recognize that kind of across the world. Like there were several people recognizing it, but the Oregon doctors actually had a hand in that and identifying it. It was there was really an abundance of caution around it, but they hospitalized every kid that they thought had the myocarditis, but they didn't get very sick, luckily. Most of them didn't.
And it
get
can
very
happen
sick.
with any virus, right?
Right.
We talked about earlier, it happened with COVID.
Right.
And so it wasn't really a shocker for it to happen from a vaccine against a virus.
But they did not see any deaths.
No deaths from
from myocarditis secondary to the vaccine. And that's a little thing that, it's not a little thing actually. These were studied. This has now been given millions and millions
7 million
of times.
doses.
7 million doses, right?
Worldwide.
And they have not seen significant risks related to this vaccine in children when they gave it. In fact, up until recently, there had been no deaths reported with the vaccine. Now they have reported some deaths from they say there were 10 deaths related to the vaccine in children. The current administration has said that. Unfortunately, they actually didn't identify any of those. So we don't know where that information is coming from. We don't know where that information was obtained, if they actually researched how that is, who researched it, because that does make a difference. There were cases that did show up in the initial VAERS data. And again, when we first started talking about vaccines.
Which is the vaccine adverse events reporting system.
Right.
It's a self-reporting system.
And those were really, really, really well researched by the members of the VAERS team that were on when those were originally reported. And they did not find them to be related to the COVID vaccine itself. There was other mitigating factors in all of those cases. But we don't know where this information is coming from. All we know is that it wasn't there before.
Right.
And that is part of what is, unfortunately, the whole COVID-19 and why it's become so controversial, is because there is a lot of information that is just not true and is rumors or other talking points. And so while we find this hard too, that's why we wanted to talk about it.
Right. And so we're going to talk a little bit about some of the myths that have developed around the COVID vaccine. And one myth that we had heard was that mRNA vaccine can change our DNA. This is absolutely not true.
This is literally impossible.
Literally impossible. And, we're going to take you back to AP Bio, maybe early college bio, and just talk about why this can't be true.
Right. And so there are DNA fragments in things. There are actually DNA fragments in lots of things, right? Anything living has DNA.
Bacteria, viruses, yeast.
Yeah, food. Plants we eat has DNA, right? So if you are eating a food, you are going to be eating DNA
and that's
fragments.
Okay. It's not scary.
It is. And there's no reason it should be scary because DNA is part of life, right? So yes, when we produce vaccines, it requires us to use cells. Cells have DNA, and there are some DNA fragments found in all vaccines, just like we talked about in even antibiotics or
and a
insulin.
lot of medicine.
Yeah. But it is not dangerous, and especially in the amounts that we have it in. And in an abundance of caution, they really track this with all vaccines. And every vaccine is trying to be kind of updated and made better. Again, we've talked about that in episodes in the past, where we're trying to use less antigens, less of everything, and making it purer to have less side effects and all of that.
But still
with
to
it.
make sure it works.
To make sure it works. And so, so we aim for the purest form, and the FDA had required less than 10 nanograms per dose of residual DNA fragments in any vaccine for full approval. And that's still where that was, and these mRNA vaccines really fall way under that. So that is not like a really big concern, even though it is being talked about. The other really important to realize is that our cells are smart.
Yes, they do. They constantly, like we talked about, they're not hoarders. They're constantly looking at ourselves and making sure things are safe.
Right. And so even small fragments of DNA, or humans have a default protection response when exposed to foreign DNA, whether that's from food, viruses, anything. And basically it gets destroyed.
Right. Like in the cell, and like we said, like a shredder, like the DNase is what we call the enzyme. But I like to think of it as like a chopping block, like a chef is cutting up vegetables. It's like, I'm cutting into tiny little pieces, a ninja chef. They're cutting into tiny little
really
pieces.
Tiny.
And then I'm going to get rid of it. I'm going to dump it out.
That's right. And so we have really good defense mechanisms against this. And it is biologically impossible for random DNA fragments to integrate into our genes.
When the little pieces are gone from the chopping block or the shredder, they're not just going to like jump into our DNA.
No.
They get swept out of the cell.
That's right. They lack opportunity, the DNA fragments lack stability, and they just don't impact our children's DNA either. And messenger mRNA itself cannot alter DNA.
Right.
So again, that's really important. All it supplies is a message with that protein
like
to make our
message,
antibody.
Right?
Yeah, it cannot do it.
The email message.
It would have to enter the cell nucleus, which it can't, where the DNA lives. So mRNA never gets into the nucleus.
Yeah.
So it can't go into the part where the DNA lives. It needs a secret code, which it does not have.
It's like a speakeasy. You know how you have to like say the secret thing to get into the speakeasy,
yes,
right?
Yes.
It cannot.
It cannot have the secret code. It does not have it. If it did get that code, which again it can't, it would have to then be converted to DNA, which is reverse transcriptase, which again the vaccine
special enzyme that just ignores the mRNA.
The vaccine does not have that.
Yes.
And then on top of that, it would then need to insert itself into the DNA, which is another special thing called an integrase.
Which the vaccine
does not have. So there's no way for this to do any of it. But they've actually done studies too, to say like, can this DNA or can mRNA and this mRNA vaccine affect our children's genes? And there are some really good studies on mostly animal studies, because obviously we're not going to sample
organs,
adults or children's ovaries and testes.
Yeah.
But they did really big dosing of these vaccines in rats and found the vast majority went to those like lymph nodes, liver and spleen.
Which are the organs that clean out your body, right? They cycle things through.
So none or very little, trivial amount went to ovaries and testes. And this was with massive doses of the vaccines. So again, there's no reason to ever suspect that this would affect DNA ever. And then these DNA fragments have also been shown in many, many, many studies not to affect genes. That's in general what we expect. I will say, and I just wanted to credit, there's a really great resource list for reliable and accurate resources for health information that people are trying to get out there from the healthcare professional field. And there's a, Caitlin Jetlina is a article an epidemiologist that we follow, and her information is on there too. And this was a lot of information that she has actually collected and gives all of the then pertinent resources too. So when we kind of look for these things, we're kind of looking through these resources that that often these epidemiologists have helped us find.
And they explain the science to us again, so we understand it.
Oh,
'Cause
yeah.
These are a lot of things you just don't think about.
Well, and again, we like mRNA, what we learned about mRNA was often like kind of like
Early in the science.
early in the science, right? So, so to make this make sense for all of you, we have to, like I said, read a lot and do a lot of research. But that is what we're hoping to kind of help you make really informed choices to keep your children happy, healthy, and safe.
All right, I'm Dr. Joanne Smith.
And I'm Dr. Clin Hankins.
And this is A Pod Full of Pediatrics. Thank you for listening.